Welcome to Epically OHDSI, how to define your research question.
Maya and Simone are discussing how to get started on a research project. Questions arise.
Maya, I'm interested in developing a study focusing on endometriosis patients, but I'm not sure how to specify my research question.
I can help, Simone. Are you interested in an estimation question or a prediction question?
I'm not sure of the study type as I'm not sure I understand how to specify the question. Can you help me?
Simone, here's a table that can help us discuss the types of prediction and estimation questions we can address using the ATLAS framework. Let's review it together. The types of research questions in healthcare that we can think about are prediction problems, estimation problems, and characterization problems. If we were to think about a prediction problem, we can think about patients who are newly diagnosed with a disease. Which patients will go on to have an outcome within a time frame from the diagnosis?
So for my research topic, a question might be, among newly diagnosed endometriosis or target patients, which of them will go on to have a postoperative infection, the outcome within 90 days?
That's a great prediction question. Now, if we were to think about an estimation question, we can think about patients with the disease who are treated with either treatment 1 or treatment 2, which is what is the relative risk of experiencing the outcome within a time frame from the diagnosis for treatment 1 compared to treatment 2. And we would consider this an estimation question.
So an estimation question for my topic would be, among endometriosis patients who have either a laparoscopic procedure, the comparator, or hysterectomy, the target, what is the relative risk of experiencing postoperative infection, the outcome within 90 days for laparoscopic procedure compared to hysterectomy?
That sounds like a great estimation question. Lastly, if we were to think about a characterization study, we would think about patients with a disease who are treated with either treatment 1 or treatment 2. What is the incidence or patient characteristics amongst each treatment arm?
So a characterization question for the study topic I'm interested in would be, among endometriosis patients who have either a laparoscopic procedure, a comparator, or hysterectomy, a target, what are the patient characteristics among each treatment arm?
That's right. If you want to determine if a variable causes the outcome, then you require a population-level effect estimation, not a patient-level prediction.
Thanks, Maya. Great advice. I think we should develop an estimation question. Our estimation question is among endometriosis patients who have either a laparoscopic procedure, the comparator, or hysterectomy, the target, what is the relative risk of experiencing postoperative infection, the outcome within 90 days?
Stay tuned for next steps in developing the estimation question. We will create concept sets to define the target, comparator, and outcome cohort.
Welcome to Epically OHDSI. Part 2, Concept Set Generation.
Maya and Simone are getting ready to generate an estimation study. They are working on how to set up definitions and create concept sets for the use in their target, comparator, and outcome cohorts in ATLAS.
Maya, I'm trying to create the concept sets in ATLAS for our estimation study question. Can you help me create my concept sets?
I can help, Simone. The concept sets for the study question among endometriosis patients who have either a laparoscopic procedure or comparator or hysterectomy, our target. What is the relative risk of experiencing post-operative infection, our outcome, within 90 days in the T and C cohorts? Let's review an ATLAS.
Maya, I found a publication that could guide us on how to implement our study definitions.
Sounds good, Simone. Let's discuss how we can implement it and how we can search for concepts and compare concepts.
We can pull up ATLAS and begin our first search. First, we can look for disease of interest, endometriosis. You can type that in the search bar and see the results that come up. We can choose the SNOMED concept ID for endometriosis. We can create a new concept set for our term. We can choose all the descendants under this SNOMED concept ID and take a look at the included concepts. We can sort our concepts by descendant record count. These are the record counts that the database that Atlas is pointing to will reference. We can also look at the record counts for the individual SNOMED terms.
Maya, in the paper that I was discussing before, they talk about including source code 617.xx. Is there a way that we can check that this SNOMED term contains those source codes?
Yep, we can go to the included source code tab, and we can filter by the vocabulary we are interested in, ICD-9. And we can see that 617 and all of its relevant codes are included in this concept set. We can name our concept set and save it. Next, let's define our T, which is hysterectomy. Here we have the results of hysterectomy in our vocabulary. We can choose the concept hysterectomy and take a look at the hierarchy view. This view will allow us to look at the parents of the term we've chosen, also look at the children that fall under the term we've chosen. So in this case, we can look to see if we want to include other concepts at a higher level, which would include more codes, or if we want to look at the children and perhaps exclude one of the codes under here. For this estimation question, I think the term we've chosen, hysterectomy, includes what we want. Next, let's create our C, which is laparoscopy. Here we've pulled up the results for laparoscopy and ordered the results by descendant record count. Here we see many vocabularies that have a higher record count than some of our standard concepts. For this definition, we can think about using the concept compare feature to make sure we choose a concept set that best describes the procedure we're looking for. So we can save the standard concept ID, laparoscopy, at the SNOMED level, and then go to the compare tab. We can compare two different concept sets. We've previously created a narrow version of the same concept. We can hit compare concept sets and take a look at which concepts appear in one concept set, both concept sets, or the second concept set. In this case, we see that there are 22 concepts that appear in both concept sets. And we see that all of concept set 2 is included in concept 1, and 84 concepts are not included in concept set 2. We can use the results of this feature to make a decision on which concept set to use for our definition of laparoscopy. Our last definition we need to create is for our O, which is post-operative infections. Here we've chosen the concept for post-operative infection at the SNOMED level. We can go ahead and choose descendants and save off this concept.
Stay tuned for next steps in generating the target, comparator, and outcome cohorts for the estimation question. Among endometriosis patients who receive laparoscopic procedure, our comparator, or hysterectomy, our target, what is the relative risk of experiencing post-operative complications, the outcome, in C versus T? Welcome to Epically OHDSI, Part 3, How to Create Cohorts for an Estimation Study.
Maya and Simone are getting ready to generate an estimation study. This episode will feature how to create the T, C, and O cohorts in Atlas.
Maya, I'm creating my cohorts in Atlas for our estimation study. We need to restrict your population to 18 to 49-year-olds and exclude patients with uterine fibroids.
I can help Simone. Let's review in Atlas. We can begin by defining our T cohort. So we can go to cohort definitions and create a new cohort. Our T cohort represents those that have had a hysterectomy. So we can choose procedure occurrence and import in the definition we previously created in the previous video. So here we have our hysterectomy definition. We can provide 365 days of look back for the people in the cohort. We can add the additional criteria, Simone, that you were thinking about, such as age between 18 and 49, by selecting Add Criteria Attribute and Add Age Criteria. We can also add the gender criteria. Look for only females. we can now add in additional event inclusion criteria to exclude those people that have had laparoscopy in this cohort, because we do not want those in our T cohort that have already experienced our C, which is laparoscopy. So we can look for exactly 0 occurrences of laparoscopy in the past. We also need to add the disease area of interest, which is endometriosis. So we can choose a condition occurrence of endometriosis all time prior and 0 days after. You also mentioned you wanted to exclude people that had uterine fibroids. So we can go and exclude folks with uterine fibroids in the past 365 days. By creating a rule as a qualifying inclusion criteria, we choose a condition occurrence of exactly 0 uterine fibroids that we've previously defined, and create a time restraint to look for those conditions in the past 365 days. This is comprised of our T cohort. We can now go ahead and save our cohort and go to the Generation tab, where we can kick it off on one of our databases. Now we need to create our C cohort, which is those that have experienced a laparoscopy. The easiest way to do this is go ahead and take our T cohort, which we've previously defined, and go to the create a copy of this cohort definition and create a copy of the cohort. Because our comparator will just be those that have experienced laparoscopy with the same criteria for age and gender, we can just flip the definitions and add laparoscopy here and flip it so that these people have never had a hysterectomy in the past. The remainder of the criteria remain the same. They all must have an endometriosis diagnosis in the past and have no uterine fibroid diagnoses in the past 365 days. We can save this cohort and then go ahead and generate it. Lastly, we need to create our O cohort. This would be the outcome of post-operative infection. For this cohort, we just need to find the people that have had a condition occurrence of post-operative infection and allow them to have at least 365 days of enrollment and generate this cohort. Now we have created all of the cohorts for our T, C, and O to be used in our estimation study.
Thank you for watching our videos. Please let us know your thoughts about this media and content so that we can make better videos in the future. Please go to this link to fill out a short survey that will ask 6 questions about what you saw. Thank you for watching.